better not miss any of this stand. When do I? Sitting, standing, walking, focusing on range of motion, stretching, strengthening, and then trying to work in more combination exercises that hits, 2 or 3 muscle groups if you can. In terms of positioning, goals of positioning is to minimize the contracture formation, edema, maintain full range of motion as possible. They recommended changing position the patient every 2 to 4 hours. They said this 2 or 3 times, so it's in here 2 or 3 times also. But they were constantly like, if they're, if the skin is healing in one position, then you want to stretch the opposite position. It's important to stretch in every range of motion, but for sure, you're trying to go against the way they're naturally contracting. Work on their sitting tolerance, make sure they have good posture, work on trunk rotation. Some of these things, I think I specifically get into just the normal flow of like how I go and do my treatment. So I don't really think about outside the box. Even if it's taking an exercise ball or something like that in there, I think would be good, especially for a burn patient working on trunk stability. And then make sure you're looking for compensatory movements when you're doing range of motion, focusing on both static and dynamic sitting or standing for that matter. Standing, doing ADLs and standing. If they can't tolerate standing, then they said use a tilt table. We have those Vital Go beds, which people either love or hate. So, but it is, for burn patients, I think would be a good option. Ambulation, get them moving as quickly as you can. Again, watching for compensatory movements. Are their ankles tight? Are they circumducting? Do they have a flexed trunk? Decreased arm swing with their gait patterns? Then kind of went over things that affect, you want to encourage them to do range of motion as much as they can. Sometimes when you're helping them do range of motion, it's more effective because of the pain, weakness, fear. So then if you can encourage them to do the range of motion themselves and be more forceful with it, they can often fight through some of the pain a little more and actually be a little more aggressive than maybe we would. And then it's going to clearly help with edema reduction, increase their circulation and all that. Strengthening range of motion is, maintaining the range of motion is always a priority. Working on strengthening all their muscle groups and encouraging functional tasks within your strengthening exercises when that's a possibility. We're not getting very big burns right now, so I feel like in large part we probably could do a lot more functional things like in standing and gait and things like that. So we definitely could do more functional tasks with these patients because their burns are not as severe. And then again, it was saying like if they start developing tightness, inflection, then work on extension kind of thing. You do stretching activities, I would say the rest of their life, but they say until scar like mature. That kind of depends. It could take, up to a year or longer for a scar to fully mature. Limit the number of exercises that you're giving them. You can do what you want, but if you're giving them homework, don't bombard them with 50 different exercises. So they're more likely to actually do them. And then working in the combination exercises. Splinting, obviously it's to reduce contracture formation, deformity, maintain range of motion. It's done by applying a low static stretch to the burn surface and the pressure to help limit hypertrophic scarring, hopefully prevent it. Splint, this is more for upper extremities. And I'm the only OT. So that's fine. Are you an OT student? No, are you? That's too bad. You tell your OT friends that these are the position we want them in. And so, which basically is just the wrist back, your MPs flat, with your PIPs, ZIPs extended in your thumb and what they call palmar abduction. Things to remember, splinting can contribute to intrinsic tightness, so it's sad that there's no OTs in here because this is very geared toward them. But so incorporating elongation exercises in their exercises. If they have palmar burns, they typically require more finger extension, and then the radial thumb abduction. So instead of being palmar, it's more out to the side to open up that palmar surface. The burns are present on both sides of the hands, then you got to figure out how you want them to scar down, basically, which, motion you feel like, and hopefully they can talk with you too. That's most important for them to maintain and work toward that. And then always doing your range of motion in every direction. I like this part. This was kind of different, I guess. For facial burns, it's talking about the social, psychological, emotional effects that they have. But people don't think about it, but it impairs so much with your speech, communication, your hearing. Psychologically, it's just a huge hit because this is how you interface with the world, so it's a big deal. And they were talking about face and neck exercises and things you could do, and that's just a little chart that they had, which basically is moving your face and eyes and neck in every direction. I liked it. That's it. Does anybody have questions? No.
Did you practice the mouth exercises?
I did not. I actually, speech therapy is my undergrad degree.
Really?
Yeah. So I know them, and I have done those with patients before.
I like just reading them. I would start doing.
Just because I don't think you would think about doing some of those, really. So, I like the visual. I might actually print that off and just keep it in my notebook just to trigger a thought. But they're good. And definitely, patients who burn their lips, they a lot of times develop microstomia, which is where the little mouth gets small, and they can't really eat. They have to wear special splints to stretch all that out. It's really super painful. So these exercises, the skin on your face is just as important as anywhere else. So, really, literally teaching them these exercises is huge. So, that's it.